by the end of the century, more than the whole of Western Europe, more than China, more than the United States, and more than the whole of Latin America. In how the world is going, the institutions, the policies, the programs, leadership and management of regional and global affairs, the economic foundations of our civilization. The changes are going to be enormous and very real. And this is an opportunity that we need to prepare for right now, today. And that's why this commission is much more than a blueprint for a new health system for Nigeria. This commission offers a vision for a nation that in just a few generations will be assuming an unprecedented global leadership role. It's vital to invest in health, and I have done education, in primary care, health facilities, universities, to fully seize the demographic dividend that is here today. And my commitment to you is that the Lancet looks forward very much to working with you in the coming years to this incredible
I think we might have, unfortunately, just lost Richard Wright as he was concluding. We're very grateful to have Richard give some of his remarks, given the importance of...
I can't really hear you.
You know, the organization that really supported a lot of the work done in this report. So we'd like to please invite Caroline Jehu-Appiah to give her remarks. Thank you.
Well, there were many publications on some elements of Nigeria's health system and disease burden. There was a need for a landmark report to present a comprehensive and critical body of work to provide a framework to research and shape Nigeria's health agenda for the next decade. So this work began in earnest in 2020, and we would like to acknowledge and appreciate the leadership of Professor Ibrahim Abubakar, Dean of UCL, who convened a multidisciplinary group of Nigerian academics in collaboration with global experts and heads of key Nigeria health agencies to put their brainpower together to work on the Lancet Nigeria Commission report. So I'd also like to use this opportunity to thank the health commissioners. So we are all really excited with the product, the publication, which not only provides a historical perspective on the state of health in Nigeria, but also provides insights into the challenges in healthcare delivery and evidence for a framework and new narrative for UHC and the future of health in Nigeria. As a partner to the Nigerian government and people, the Bill and Melinda Gates Foundation has always supported development efforts and is vested in seeing Nigeria leverage its enormous human capital for sustainable economic development. We are thankful for the opportunity to be a part of this landmark report and believe the recently inaugurated Healthcare Reform Committee that the VP spoke about provides an excellent opportunity to translate the work of the Lancet Nigeria to undertake the necessary healthcare reforms. And as has been said, the most important ingredient is political will. So we join hands with other partners and reaffirm BMGF's commitment to UHC and improve the lives of Nigerians. Thank you.
Thank you very much, Caroline, for joining us virtually. I understand you weren't able to be here in person, but we're really grateful for you joining us, even though we're running a little later than was previously scheduled. Thank you. I'd like to please welcome Kathy Wimp, the Acting Country Director for World Bank, to please also give us your brief remarks. Thank you very much.
Thank you so much. And I'd first of all like to congratulate the authors of this report, because at the World Bank we're in the report writing business. And I can tell you that writing something which is both this comprehensive but also short and crisp and concise, but also sufficiently detailed and charting a concrete way forward, is much, much harder than it looks and takes a long time. So congratulations to you all. At the World Bank, we're very proud to have worked alongside the Government of Nigeria tackling health issues for many, many years. We just brought our pretty successful polio project to a close, which supported Nigeria to eradicate wild polio. We've supported the government to implement a number of operations that have used results-based mechanisms to channel funds to the service delivery level at the states. And one of the suggestions I would like to make about how we could help you going forward is that in many, many countries, the health system is structured around central direction but local delivery. And in very few countries do the people doing the delivering work for the central government, which is doing the directing. So how to get the right incentives in that kind of a system is one of the great challenges of running modern public health systems. And in many of the countries where I've worked, central governments use conditional funding or results-based funding to achieve those outcomes. That kind of funding is not a tradition that Nigeria has used in the past, but it's a place where the bank can help to try out these new approaches, which might be a model for how this could be done in the future. So I would also like to end by saying I think the greatest strength of this report is that it is written by Nigerians for Nigerians, and that's an incredibly powerful thing. We would be very happy to stand beside you to help support where we can to implement this. But I think ultimately what we also hope is that this kind of a report will hasten the day when we've done ourselves out of business, because the kind of health system that Nigerians aspire to and deserve can be financed from your own revenues. So congratulations, and wishing you all the best for the future. Thanks.
Thank you ever so much, Kathy Wimp, for your remarks, especially highlighting that this was a Nigerian written report for us Nigerians, which is always great, because we have a responsibility to own our own health sector. So thank you for that. And finally, last but not least at all, I'd like to please invite Dr. Betta Edu, the Honorable Commissioner for Cross River, and also the Nigeria Health Commissioners Forum head. So welcome, and thank you for your remarks too.
Thank you. Very distinguished Right Honorable Senator Oloribe, and indeed all the very wonderful heads of MDs at the national level. So there's Professor Sambo, Dr. Dyer, and others. I want to very, very respectfully recognize our dear Dr. Chikwe, who is back here with us today. I've not seen you in probably 6 months or 8 months, and Nigeria misses you. Thank you for coming. And then, of course, the wonderful partners that are all seated here, WHO, country representative, World Bank. Let me especially recognize the representative of the Minister for Health, and also Dr. Sani, and indeed everyone in the room. Good evening. I think the time is long spent, and we need to be out of here as soon as possible. First, let me start by saying a very big congratulations to the Lancet Nigerian Commission for the wonderful report and the wonderful work they have been doing. I can't emphasize how useful this will be as a foundational document to address the challenges that we have in the Nigerian health sector today. Sitting back there and listening to Professor Ibrahim Abubakar, I asked myself some very pertinent questions. What's new? What's different? What have we not heard before? And all I could just tell myself is, maybe we have not done. We've heard, we've discussed, we've said, we've written, but we are yet to do adequate enough to rescue the health system. The SGF was very, very explicit in his speech, and he said, money is not the problem. And I very well agree with him. I make this argument every single day with my colleagues, with everybody else. Money is not the problem. The problem is governance. The problem is strategic planning. The problem is use of data to inform policies. The problem is the infrastructure, is those things which the system on its own should be able to have going before you throw money at it. Like I said, even if you throw $1 trillion into the health system, it won't work until we get the basics right. And really, this report has thrown those points out, and I believe that we will use this as the basis for the Health Reform Committee, which the President has set up. We will use this as the basis for the Primary Healthcare Summit, which is coming up next week. We will use this report as the basis for our interventions going forward, or in fact, an overhaul of the health sector going forward. I want to believe that the right persons are in the room today, and they have heard, they've listened to us. I want to believe that everyone is sincerely committed to making reasonable changes that might affect the status quo, but we're ready to make those changes and chart a new course for the health system. I want to believe that with that commitment, both from government, partners, and indeed Nigerians, we can be able to achieve the healthcare system of our dreams. Once again, I want to thank you for this thorough job you've done. I'll really love to get the link so that I can share it with my colleagues immediately and really emphasize on the reason why they need to go through it. I just sat there, I kept reading and reading over and over again, and I think this is truly a reflection of Nigeria for Nigerians. The positive part is that there are opportunities that exist. Those opportunities have been clearly stated, and I believe we'll build and capitalize on that. From all the commissioners for health, we want to say a very great thank you. We are the foot soldiers on ground, and we believe that we can decentralize the healthcare system more and work with the commissioners at the state level to achieve that change in the health system. Thank you once again, and God bless you all.
Thank you very much, Dr. Betta Edu, Honorable Commissioner for Health, Cross River. We'll definitely be sharing the link with you so you can share it with all the other commissioners straight after this, session. Last but not least, I know we're really, really running for time, and I wouldn't want to rush too much this last closing remark, given the distance traveled to give it. I'd like to please welcome Dr. Chikwe Hekwazu, Assistant Director General, Health Emergency Intelligence, WHO, to please come and give us your closing remarks. Thank you very much.
So, thank you, able MC. Anyway, very briefly. We've been through a long day, so it's hard to really think of what to say. But just listening, just working with this group over the past couple of years, I thought about this quote that has been on my mind for many years from Frantz Fanon, that each generation, out of relative obscurity, must discover its mission, fulfill it, or betray it. I think we all have to decide on where we will land with that. My experience, my personal experience working with NCDC for 5 years, and my experience working with all the colleagues, my brothers, leaders of the MDAs in the health sector. I hope in the next dispensation we will have some sisters in the group as well. My sister, the Honorable Commissioner for Health, always brings me back hope of what we can be. So the data in this report is stark. And by the time we read it, especially when we compare our performance, not to Europe, but once we compare our performance in this report to countries in West Africa that have a lot less resources than we do, have a much fewer human resources in a way than we do. That really is the challenging part. So if you don't read anything in this report, please read the lines on the front page that says the giant of Africa, Africa's largest country in terms of population and economy, enjoys considerable unrealized potential. The time to achieve greatness is now, with health at the heart of the development agenda. So colleagues, I really want to leave you with these words and thank everyone in this room. Our distinguished senator, who has been on various sides of this struggle from the very early days as an advocate and now in such an important position. The co-commissioners who have really dedicated a lot of time to this. Our colleagues that have worked on the report itself from Lancet, our supporters that have funded some of this work, all of us that have given time to write, to read, to be here, to listen online, who will be engaging with this report moving forward. Thank you for all your work, your determination, your resilience, and your efforts. We will not be the generation that will betray our mission. We can't afford to be. So let's leave here on an optimistic note, reflect on the report, and like was said, this is definitely not the end. This is the beginning. Let's move forward with this work optimistically to build a new future. And really grateful for everyone, to our Minister, Dr. Ms. Alex Oko, His Excellency the Vice President, the Secretary to the Government of the Federation, everyone that has come here today to join us, our distinguished senator that has stayed to the very end, and of course, my brother and colleague now in WHO, our WR in Nigeria. So thank you, ladies and gentlemen. I think this is a good place to end. Thank you for the excellent team that put this together. Thank you, Nigeria Health Watch, for your work. This has been a great event. Yes, we've run a little bit over, but ultimately, I think the last person I have to thank is my brother, colleague, who has led us on this journey, forced us to give up some of our time, not forced, but encouraged and nudged in his own very special way. Please, ladies and gentlemen, please let's give a round of applause to Professor Ibrahim Abubakar for the work he's done. Thank you very much. So thank you. Have a lovely evening. Thank you for coming.
Thank you very much, Dr. Chukwe Hekwazu, for your closing remarks and for thanking everybody. I'd like to just finally say there are dinner vouchers that are being given out as you leave. Please, please, please do take them. We're having dinner in the main restaurant. So please ensure that you grab one before you leave, and don't leave before you've had something to eat. We've kept you here for a long time. Professor Abubakar, would you like to just close this event? Thank you so much.
Thank you very much, everyone. And I just want to say it's been a fantastic event, but I agree the work starts now. And in particular, I'd like to ask Senator Ibrahim Olorogbe and the Commissioner of Health from Cross River State, Beta Edu, that we would like to link up with them and with all the commissioners to take this forward. Thank you, everyone, and have a nice evening.